The Health Ministry has updated salary guidelines for the community care sector, recommending an increase of about 7% or more in annual total compensation for most roles. The move is expected to benefit over 23,000 staff. Natalie Ong with more.
Social workers, nurses and therapists are among roles in the community care sector which could soon benefit from the salary increases. The Health Ministry says community care organisations should use the guidelines to enhance fairness in pay structures and salaries. While not mandatory, the ministry says community care organisations are strongly encouraged to adjust the pay packages by early next year. This will also give staff time to review. The Healthcare Services Employees Union says the move will create a more level playing field for workers.
It is important to look at not only the salaries per se, but also the job nature and where there's opportunities for job redesign and whether we can automate some of the mundane processes with the support of funding or grant. At the same time, when we look at the career progression for this group of people.
She added that about 70% of organisations have aligned their salaries with the current guidelines. The community care sector salary guidelines were first published by the Health Ministry in 2024. The aim was to help organisations better attract and retain talent while providing greater transparency to workers. One community care organisation, which aligned its salaries in 2024, says the move is timely and reasonable given the country's growing healthcare needs.
I think it's important to acknowledge the fact that healthcare workers are very much in demand at this point in time. And we have to attract talent, we have to retain talent, and organizations have a lot to do to keep the people that they already have, as well as to attract people from other industries.
Ren Tzu Nursing Home says it is looking at the salary revision seriously to ensure compensation remains competitive and aligned with sector guidelines. The Health Ministry says it will continue to monitor the salary competitiveness of community care staff against the market and review the guidelines as necessary.
And for more, I'm joined by Elvin Aloysius Goh, who is CEO of the Singapore Human Resources Institute. Now, Elvin, why is this update coming at this time for the community care sector? What has changed since the first guideline in 2024?
So thanks for having me. I think number one is that Singapore has definitely a shrinking and aging population. Our data has actually shown that 1 in 4 citizens will be 65 years and above come year 2030. And you extrapolate that data and you look at what is really the needs of the society in terms of healthcare. Therefore, if we look back in 2024, it's become very clear that workforce sustainability is not a future issue, but an immediate one. And I think this update is definitely in the right direction, reflecting the growing urgency to strengthen and as well to support community care workforce as well.
Yeah. While it's timely, do you think a 7% increase would meaningfully change how attractive community care jobs look, especially when you compare that with hospitals or other healthcare settings and even other sectors?
I think overall, looking at the profile of workers or employees in such community care jobs as well, I think there's the meaning and purpose in terms of what they do and everything. And the motivation is really genuine. I sit on the board of the Center for Asian Nursing, and some of these community care employees do really have the passion to want to perform and work in this sector. Right? But the honest truth is that life still moves on. And when employees start families or having other family commitments, passion alone can only go so far. And I think it's really timely that this 7% increase really matters. And it's not just a number. For the 23,000 staff, in this community care, it also signals to them that they are valued. And when people are valued, or when they feel that they are valued, they are more likely to stay, to grow, and also to bring others into the sector. That this sector is not a dead-end job. It is a sector that tries on both passion and as well as there is also the extrinsic motivation of proper compensation as well.
Yeah, well, there's definitely value to this. The salary review guidelines are also not mandatory. So do you think employers are willing to raise these wages when it cuts into their bottom line?
I mean, that's a great question, right? And the honest answer is that some will move quickly, some will be very cautious. While these are guidelines and they are not mandates, the market will do its own enforcing, and balancing act at the end of the day. Organizations that do not move forward or find this or adopt the 7% guideline will find it harder to hire and perhaps also harder to retain their employees. And the government's $100 million support package reduces this wage cost already and is an excuse not to act. That said, wage decisions at the end of the day do not exist in isolation. Funding models, board priorities, organization priorities, operational sustainability will have to come into play. And, CEOs and management of all such organizations will still need to think and consult and consider all these parameters itself and really plan carefully on how much they will want to actually raise the salary bar as well.
Will the raise then be enough to attract more workers to the industry, especially when the demand for community care services is set to rise even more?
I don't think just with this 7%, it will really attract more workers to the industry. I don't think no single measure will be enough on its own, and definitely salaries is just one part of the entire equation as well. Besides making our employees feel valued, definitely they will continue to stay and grow. I also honestly feel that the work that SHI has done in terms of job redesign, and so forth, training leaders, training managers to become great leaders, to really take care of their employees and the staff of such organizations, it will go a longer way as well. Dollars and cents is just one of the equation. People don't just stay for the dollars and cents. They also like to thrive in an ecosystem whereby it's a safe environment for them to voice out, to innovate, to share ideas, to share concerns, and so forth. I think there's many more that organizations could and should do to look at staff retention beyond just the $7. After all, as a lot of the changing values of our future workforce as well, the millennials and so forth that's going to come up into the workforce in the next couple of years, they value friendship, they value social being and so forth. There's a lot of things that a lot of organizations should and must consider beyond the dollars and cents.
Yeah, if you can give us some specific measures or ideas that you might have to actually, encourage more people to stay and also to join the sector, what do you think that will be?
I think the first thing that comes to mind would be the learning and development aspect as well. SHI did some studies in 2022, 2022, 2023, and what we found was that the social compact or the social bond between employer and employee is the opportunity to upgrade themselves through learning and development opportunities, to create an environment whereby ideas are shared, innovation takes place, processes are streamlined to be customer-centric, policies itself are not only patient-friendly, but also not saying patient-friendly, but in general terms, customer-friendly, but also staff-friendly as well. I think all this, if you put it into the ecosystem and the mix as well, and I think that's where the sustainability of being able to attract talent into this industry will continue. And it builds long-term sustainability in the longer sector in the sector as well. So we have to really look beyond the dollars and cents of com and ben as well. And in fact, the government has also talked about and implemented things like flexible work arrangements, and so forth. And I think organizations must be quick to adopt all these parameters into their employee value proposition.
Alvin, thank you so much for sharing your perspective with us. That was Alvin Aloysius Goh, who is CEO of the Singapore Human Resources Institute.